about perimenopause and menopause. So menopause is a phase of a woman's life where there is cessation of periods, of menstrual cycle. It's the end of reproductive years for women. Every woman goes through this phase. It happens for women late 40s, early 50s for someone. Now there's a phase which every woman goes through right before her menopause, which is called as perimenopause. This is a transition phase. This is where estrogen, progesterone, the female hormones, starts to drop. So the woman goes through a lot of menopause-like symptoms like weight gain around the abdominal area, mood swings, they get cranky, a lot of mood issues, sometimes they feel happy, sometimes they feel sad. A lot of women goes through depression, anxiety, brain fog, confusion, forgetfulness, hot flashes, insomnia. This is very common. Vaginal dryness, urinary issues, loss of libido. Now a lot of women faces this kind of problem around 8 to 10 years just before the menopause. And the average length of menopause could be around 4 to 5 years for someone. It could be few months for someone. A lot of women faces early perimenopause, early 40s, even late 30s for someone. Well, this could all be because of genetics. Maybe the mother must have gone through early menopause, surgical procedures like removing of ovaries, uterus, hormonal imbalances like PCOS or PCOD which has not been managed properly, endometriosis, people who are smoking, people who have gone through cancer of pelvic, people who have gone through chemotherapies. So such women might face early perimenopause. So this is individual specific. Every woman goes through this, but the lifestyle or the diet plays a very important role in managing the phase of our life. We can all manage this with proper nutrition and lifestyle changes. Now some women might even experience very severe conditions like heavy bleeding, getting blood clots. One more symptom a woman goes through during perimenopause is irregular periods. So I'll explain this with a graph. So whenever a woman is going through periods, this is how the normal, the spike of estrogen and progesterone happens. So this is how your hormones go whenever you're going through periods. There's rise of estrogen during the follicular phase. Then whenever you enter luteal phase, the estrogen drops and progesterone starts to rise. So these are the normal ways how the hormone goes, and this is especially for women who do not have any hormonal problems. They're getting their periods after 25 to 28 days. So the period cycle of such women are very normal. So this is how the estrogen and the progesterone works. Now if a woman enters into menopause, this is how a hormone looks like. So this is estrogen and this is progesterone. There's a decline. And this is also a very predictable state. Now what happens if a woman enters into perimenopause? This is how her hormones look like. They are all over the place. So it could be like this. So this is how it is. It is like a roller coaster. They're very unpredictable. Hence a woman faces a lot of irregularity in their periods. Sometimes they're heavy periods, sometimes they're light. But how you can see you got into menopause? Is when for 12 months a woman does not get periods. So that is confirmed that she enters into menopause. Before that, she is going through a phase which is called as perimenopause. Now when should she go and see a doctor? Whenever she faces heavy periods, painful periods, blood clots, fibroids. All these symptoms, when they start to interfere with the normal functioning of a person's life and they cannot do day-to-day activities, then probably she should go and see a doctor. Apart from that, vaginal bleeding after sex. This is also something a cause of worry and she should visit a doctor. Apart from that, if she's getting these kind of symptoms, they are very uncomfortable, that's for sure. But they can be managed with lifestyle change and dietary changes. Now whenever you go to visit a doctor, they might put you on antidepressants. They will give you vaginal creams. But there's something that they do is they start giving you HRT. Hormonal replacement therapy. So they use synthetic form of estrogen and progesterone. We always as nutritionists feel that this should be the last cause. If you can manage your symptoms with diet and nutrition and lifestyle changes, there's nothing like it. Even when you're resorting to the last source, which is the HRT, it should be the bioidentical ones, not the synthetic form of hormones. Because if you're taking synthetic form of hormones, there are a lot of complications and side effects. Probably heart attack, stroke, uterine cancer, gallbladder. So why we should put up with all these things when we can manage them with diet and nutrition? So what precautions, diet and lifestyle change a woman should go through whenever she's going through menopause? You know that women in perimenopause phase can get pregnant because as long as she's getting her periods, even if they are irregular, and if she's still ovulating, she can get pregnant. It does not happen when she enters into menopause. Now what diet and lifestyle change she should go through? A woman should increase the amount of vitamin E in her diet. Vitamin E plays a very important role in managing the symptoms of perimenopause. Vitamin E is found in extra virgin olive oil, nuts, seeds like almonds, pumpkin seeds, green leafy vegetable, eggs. They contain good quality of vitamin E. Apart from that, she should increase calcium in her diet. Whenever a woman goes through menopause, she gets into a symptom like osteoporosis. Osteoporosis is bone loss. Whenever there is drop of estrogen, progesterone in her body, there is bone loss in her body, and women are prone to osteoporosis. So she should include foods that are rich in calcium. We know milk and milk products are good source of calcium, but as long as they are organic, it's fine, because a lot of milk products contain hormones, antibiotics, so they disrupt our gut health. They cause hormonal imbalances. They are inflammatory in nature. So apart from dairy products, you can also get calcium from sardines with bones. You can have green leafy vegetables like amaranth leaves, drumstick leaves. Ragi is a good source of calcium. Sesame seeds are a good source of calcium. So include that in your diet. Increase your amount of vitamin D. Have 10,000 IUs of vitamin D every day. Include foods which are rich in vitamin D, like egg yolk. You can have fish liver oils, cod liver oils. Be out in the sun. Vitamin D is a sunshine vitamin. In fact, even getting out in the sun helps people to cope up with depression. It improves our mood. Apart from that, include foods that are rich in vitamin A, vitamin C, B6. Have supplements of B complex vitamins. Have foods that are rich in magnesium. You know, even taking supplements of magnesium glycinate is very important in getting sleep, because insomnia is one of the symptoms or problems that a woman face in a perimenopause phase and menopause phase. So taking magnesium glycinate will definitely help. Apart from that, includes food which are rich in omega-3 fatty acids, because they are anti-inflammatory in nature, like fatty fish, salmon, tuna, sardines. Apart from that, include evening primrose oil in your diet. You can take in the form of capsule or liquids. Studies have shown that having evening primrose oil has great benefits, and they tend to reduce the symptoms of perimenopause and menopause. Do weight training. Now, women in her 40s, when she goes through bone loss and osteoporosis, weight training is of great help because it strengthens our bones. It increases our muscles. So it's very, very beneficial that women, when they enter in the 40s, should focus more on weight training rather than any other form of exercise. She can do weight training 3 times a week, and the other 3 days she can do any kind of workouts like yoga, walking, high intensity, swimming, whatever she likes. But include weight training in your part of your lifestyle. Apart from that, try to reduce your stress by doing meditation, doing any kind of yoga. Try to sleep well. At least 7 to 8 hours of sleeping. That can be done by taking magnesium supplements also. Try to reduce the amount of tea and coffee in your diet. They tend to interfere with the absorption of calcium and iron and other minerals and vitamins of the body. So reduce their consumption. Limit alcohol intake. Stop smoking. Reduce the amount of processed and junk foods in your diet. Foods that are high in sugar, refined flour, because these are inflammatory in nature. They also help you to reduce weight if you're stopping and reducing the intake of processed foods and increasing the amount of whole grain cereals, pulses, lots of vegetables, good quality fats, lot of fiber, exercising regularly. Now this will help you to lose weight, especially around the abdominal area. This will also increase your metabolism. So I hope these points were useful. I'll be posting more videos related to nutrition and health. This is Menka Vision signing off. Thank you.